Hi everyone, this is Connor Downey, and you are listening to the Vitalis Podcast.
Hello everyone, and welcome back to the Vitalis Podcast. This is where we uncover the truth behind healing, health, and human potential. Now, I'm your host, Connor Downey, and today's episode is personal because fertility is about more than just reproduction. It's about vitality, and it's about how our bodies are functioning at the deepest level. Now, whether you're actively trying to conceive, you're recovering from birth control, or you are simply trying to understand your hormones, this episode is your guide to optimizing fertility in both men and women through a combination of integrative, holistic, and even pharmaceutical strategies. And that's ultimately because sometimes it's not about just choosing one path, it's about combining the best of all of them. And today, we're really going to talk about what truly disrupts fertility, from gut health to toxins, from birth control to plastics, from stress to even mitochondrial decline. And we'll give you science-backed, soul-aligned ways to reset your reproductive health and support your body from the inside out. So let's get into it. Now, first off, I want to thank you all for joining me today, taking time out of your schedule to listen in. Fertility is one of those subjects that I have really found to be on the rise. There's a lot of individuals that are dealing with issues in fertility. I personally have had my own journey with fertility, and we'll speak a little bit about that today. But I am noticing that more and more men and women are having issues at younger ages when it comes to fertility, and it is global. It's one of those things that is a hard truth. And we are seeing that fertility rates in both men and women have plummeted over the last 50 years. Men specifically, sperm counts are down over 50% globally since 1973. And we are seeing that 1 in every 6 couples are now struggling with infertility, which is drastic. Those numbers are massive. And the real question is why? Why are so many people dealing with infertility? Why have we seen rates in fertility change over the last, 50, 60 years? And why are we seeing such a massive decline? 50% since 1973 is a pretty drastic number. Yes, age plays a role, but it is not the full story. And we are now seeing hormone decline, ovulatory dysfunction, poor sperm quality in over tons of people, specifically even in people under the age of 30. And a lot of it comes down to 3 key root causes. Now, number 1 is toxic exposure. We are seeing that pesticides, plastics, microplastic, BPA, phthalates, all of these endocrine disruptors are directly messing with fertility rates. We're seeing a lot of estrogenic reasons that are plummeting testosterone levels in men and changing menstrual cycles in women and making it harder and harder for both men and women to conceive. We're seeing the number 2 reason, which is mitochondrial dysfunction, which fuels poor egg and sperm quality. And then number 3 is chronic inflammation and stress, which affects everything from ovulation to hormone signaling. And so these aren't just genetic problems, they're environmental, they're lifestyle, and they're often reversible. Fertility is truly a window into how our body is functioning, from our gut to our immune system, our liver, and even your endocrine system, and even your emotional health. So let's start there. We'll start diving into a few of these. So ultimately, gut health and fertility. So a lot of people don't quite realize that our gut is the foundation to our fertility. And why? Well, it's because our gut regulates so much, starting right at nutrient absorption. So things like folate, magnesium, zinc, and B12, all of these nutrients that are foundational for our health and for our fertility, that are so important for both men and women to get for healthy sperm count, healthy egg production. These nutrients are foundational to our fertility. And then even for detoxification. So especially when we look at estrogen and we look at hormone metabolites, our gut has to be able to detoxify these areas of our body. And then that links directly to our immune system. And so over 70% of your immune cells are directly living in your gut. And without the right kind of detoxification and without a healthy GI system, we also start looking at inflammation levels. And so chronic gut inflammation can disrupt ovulation. It can impact implantation of sperm function. It can impact so many things. So ultimately, when we look at our GI health, it is the number 1 thing that we should start getting on point, which is what we're talking about in so many of these episodes. Chronic gut inflammation affects everything. It is one of those things that are going to disrupt your body in a number of different ways. And having a healthy gut microbiome, having a low inflammation status in your gut is very important. And we know that gut dysbiosis and leaky gut are directly linked to conditions like PCOS, endometriosis, Hashimoto's, low testosterone, and infertility. So what do we do? Well, for one, we want to make sure that our gut is clean. And I think a lot of people don't realize that, we have to detox what is inside of our body before we start noticing changes outwardly. whether it's even in our physique or it's in our levels, different levels in our bodies. So detox is the first step. So if you're wondering, okay, how do I get my fertility on point? What is the number one step that you'd recommend? I would go through a detox protocol. I would get your body healthy, get rid of all the stuff that is putting basically your body's foot on the brake when you're trying to drive fast. It's going to slow down everything. It's going to impact all of your levels. So let's get all the bad stuff out. Once we can do that, we start getting these endocrine disruptors, right? We talked about the massive impact of phthalates and BPAs and all these microplastics, especially when we look at fertility. So you want to start detoxing a lot of areas of your body. The other thing that's important is as we start trying to improve our GI health and we start looking at how do we get our gut healthy, there's a few really important probiotic rich foods that we want to introduce. So things like sauerkraut, kefir, coconut yogurt, a lot of these things that are going to be very healthy. Apple cider vinegar with mother is a fantastic one. I think we're seeing a lot of pro longevity strains in a lot of these foods and a lot of these things that people can be taking on a daily basis. So introducing truly probiotic rich foods into your GI system after your detox is going to help you to recoup. Right after that, we want to start looking at taking high quality probiotics. So look at different probiotic blends. I really like the company Seed. I think they have a fantastic mix of probiotics. They have a really fantastic design when it looks at that double encapsulated series of probiotics that can make it past your stomach acid and deeper into your GI system. So you're wanting blends with Lactobacillus rhamnosus, Bifidobacterium longum, and Lactobacillus reuteri. And so these are going to boost oxytocin and they're going to improve implantation. So when you're looking at fertility, you're looking at when it comes to conception, we want to make sure that we have healthy levels there. And right off the bat, getting your GI system healthy to improve oxytocin and implantation in the body is going to begin with these bacteria. So you also want to support the gut lining with things like bone broth, glutamine, collagen, other fermented foods. These are going to be really important for your GI health. Fermented food is very, very important. There's a lot of men that I've actually spoken to as well. And a lot of these men are noticing that more fermented foods, more things like cheese and wine and different things that are going to add this kind of healthy gut bacteria directly affects that level of sperm quality as well. So it's important for both men and women. And then avoid gut disruptors. Right? Truthfully, I would stay away from alcohol, stay closer to the fermented food lists, stay away from conventional dairy, seed oils, processed carbs, stay away from those unhealthy things that are going to start impacting your body. Especially we've kind of talked about the impact of folic acid and all of the grains that are sprayed with folic acid. So I would avoid folic acid, opt in for methylfolate, get foods that are rich in folic acid, and protect your body's natural methylation processes to convert a lot of these vitamins, especially your B vitamin, your suite of B vitamins into a methylated form. It's going to be very important for healthy hormone levels and fertility levels in the body. And if you've been on things like antacids or antibiotics or hormonal birth control, your gut microbiome has been depleted. It is just a known fact. So rebuilding it is foundational, resetting your reproductive health. That's the first step in doing so. So a lot of these things people don't realize that your body can get robbed of so many nutrients. I advise everybody to look at the medications that you're on and look at the disruption of different nutrients. I can tell you that the three that I listed, like antibiotics, antacids, and hormonal birth control, have direct impacts in our body's natural nutrient absorption and storage. And so we see depletion in so many nutrients in people that are chronically taking medications like this. So look at them, do your own research, but I can tell you I would avoid those as much as possible, especially if we're just looking at the gut microbiome. It disrupts it to a point that is very, very detrimental, not only to our immune system, but also to things like what we're talking today as far as reproductive health is concerned. So protect your gut's microbiome, get really good foods and really good probiotics, especially foods that are rich in prebiotics that are going to feed that. So especially a fiber-rich supplement or just even fiber-rich foods that are going to feed these probiotics and keep your GI system healthy. It is incredible the amount of benefits in our GI tract and in our gut microbiome when we are feeding our body with healthy fiber. There's a lot of great fiber supplements out there. I would opt into something that is 100% organic, is a very easily digestible form of fiber that has a lot of really good reviews. There's an organic fiber supplement through MSM Nutrition and a few other great companies out there. So get on a fiber supplement, especially if you're looking at disease. There are a lot of direct correlations between disease risks and healthy gut microbiome. And we see that for every several grams of fiber that we're introducing into the GI system, we're we're seeing substantially lower disease rates in a number of people. And even when we look at cancer, we see that as we start introducing high fiber levels into the body and protecting that GI system, we're noticing even higher remission rates in several individuals, which we'll do another podcast episode on. But fiber is a very important, very, very important nutrient. So even just making sure that you get your daily dose of fiber in, even if you're just consuming like a 5 to 7 gram fiber supplement, that's a fantastic way of just making sure that you're getting a nice daily dose of fiber in on a consistent basis. If you're doing like a detox, if you're doing a parasite cleanse, if you're doing any chelation, if you're trying to flush out anything out of your body, or if you're taking binders, that's another thing as well. So if you're taking anything like activated charcoal or, any type of seaweed or anything that's going to act as a binder and a chelator, I would recommend taking those away from any kind of supplements or medications, especially activated charcoal, anything that's going to grab onto it. Make sure that you're giving yourself at least a 2-hour notice between the time that you take this binder or activated charcoal and any medications, probiotics, fiber, any major supplements. If you're taking things like we've talked about with iodine and some of these chelators, make sure that you're giving that a 2-hour window where it's taken all by itself before you're consuming anything else, including food, or any other kind of nutrients that you want to make sure that you get into your body. Give yourself a 2-hour window to take and flush out anything else and then introduce anything back into the body so it has a window to digest and circulate through your system. Now, we've kind of touched on it a little bit, but as far as detox is concerned, so that next pillar in fertility is detoxification. And I specifically wanted to go into it a little bit more depth in this episode. So your liver and your lymphatic system are responsible for the breakdown of excess estrogens, pesticides, xenoestrogens, and heavy metals, which all interfere with reproductive hormones. When you start your detoxification process, some of the things that we've already spoken about, castor oil packs over your liver, over your abdomen, several times a week. I would do them at least 3 to 5 times a week if you can. Every other day is a fantastic routine. Placing that castor oil above your liver, trying to open up that detox pathways, taking fiber. So things like psyllium, flaxseed, acacia fiber, which is fantastic, are going to bind to those toxins in your GI tract. And they're also going to support that gut microbiome. Binders, which we've spoken about a little bit. So things like activated charcoal, zeolite is great for heavy metals. Fulvic acid is great for pesticides and endocrine disruptors. Fulvic acid is one of my favorites because it's also fantastic at decalcifying the pineal gland. So when we look at the effects of excess fluoride in our body and the calcification of our pineal gland, higher level thinking, and cognitive function, fulvic acid is fantastic for that and for parasites too. But for parasite cleanses specifically, the 3 best are going to be wormwood, clove, and block walnut. And pumpkin seeds are fantastic as well. Those are going to really break down that outer layer of the parasites and really reduce that protective layer that they have. And doing those 2 to 3 times a year is going to be fantastic. So at least biannually, really for most people, a lot of people recommend change in seasons. I do that. So every 3 months, I'll do a parasite cleanse and give my body a nice reset, especially if you're eating a lot of fish or you're eating a lot of pork or anything like that. Personally, I love fish. A lot of people love sushi. There's a lot of parasites that can migrate into those areas of our body. So getting that out, detoxifying that in our body at least biannually is kind of a minimum. And then heavy metal chelators. We talked about that in the last episode as well, but things like cilantro, spirulina, a lot of those heavy metal chelators are going to zeolite are going to grab and release those toxins and start kind of flushing them out of the body, which is why it's very important for us to have a binder like activated charcoal or something like that to kind of grab and hold on to those and force those out of the body. Diatomaceous earth. A lot of people like bentonite clay. Bentonite clay is fantastic. So keep that in mind. And then methylene blue. So I will say methylene blue is fantastic when it comes to supporting mitochondrial energy. It has shown the potential in boosting brain and reproductive tissue oxygenation. There is, as you kind of start diving into some of the research, there's some interesting research that kind of, I think in anything in this field is going to support and also contradict it. So you're going to start noticing there is obvious supporting evidence that shows that methylene blue has the ability to support mitochondrial function, which is going to help with depolarization of cells. It's going to help with cell energy and communication. And it's definitely going to help with our body's natural ability to, as far as metabolic support and metabolic function is concerned, to support these reproductive levels and our natural reproductive processes. However, there is a argument that methylene blue has the potential to cause oxidative stress in a way that can be detrimental to reproductive levels as well. So when it comes to methylene blue, I recommend everybody start very slow, take a low dose, anywhere from 5 to 20 milligrams is the normal daily dose. Most people, myself included, feel great between the 5 to 10 milligram mark. You're going to notice elevation in mood. You're going to notice its impact on serotonin receptors in the body, which is great. So just natural, consistent elevation in mood, reduction in depression, better focus, better energy, better recovery. All of these things are fantastic. When it comes to a detox perspective, I think, and how I've personally taken it, was really as a supporting agent in detoxification to cause essentially an increased level of oxidative stress in the body so that I could destroy and help my body to get rid of and eradicate any damaged cells or DNA. So essentially using it as a form that can push out and get rid of a lot of the bad things at a DNA level and at a malformed cell or DNA perspective. I think a lot of people look at methylene blue, and there's a lot of studies where you need to specifically look at dose, right? Like what I just mentioned, we're talking about, for one, route of administration is very important when it comes to methylene blue. When you're comparing research, most people are taking methylene blue orally. So when we're talking about oral administration, we're talking about 5 to 20 milligrams orally. When you look at a lot of these other studies, if they're giving it through an IV administration, far greater impact, right? It doesn't have to go through the GI system. It doesn't have to go through first pass metabolism. So we're going to have far faster activation of methylene blue, and it just impacts our body on a completely different level. So I encourage you to look at how is it being administered, as well as dose. Dosing is very important as well. If somebody was getting something through an IV where you have much higher bioavailability, and then you're also getting much higher doses of it, those two correlate to a much higher risk of toxicity or oxidative stress levels, the bad kind of side of things that we're talking about with methylene blue. So make sure that you're comparing apples to apples. I think a lot of people just look at specific studies that are comparing methylene blue to methylene blue, and they're not necessarily looking at how were the patients being administered this substance, how consistent was it, what was the dose, and then what are the other factors, right? What was the purpose of it being administered? So are we looking at somebody that are using them for the same case-by-case scenario, or was the administration of this for a completely different purpose, and they're using that data to kind of correlate to whatever other outcome that they're trying to speak about? So like I said, compare apples to apples. I really like methylene blue. I took it as a detoxifier for my fertility regimen. So I basically took it for a month, basically in order to cause that level of oxidative stress to any potentially bad cells in the body, while also seeing a lot of the great benefits when it comes to improvement in cognitive function and focus and energy and my ability to heal and recover. That level of oxygenation that it provides to the brain, to the tissues, is quite fantastic. So you're going to get great benefits, I think, either way. But if you're concerned about the research in and around oxidative stress and fertility, dig deeper. A lot of this research, too, that we see hasn't been redone in the last 50 years. So it's very important that we're seeing up-to-date research that we're comparing back to back and comparing the right kind of research, And essentially, I want to make sure everybody knows, before you do any kind of detox stuff, make sure that your detox pathways are open first. Make sure that you're getting plenty of hydration, that you're getting consistent bowel movements, you have liver support before ever introducing binders and chelators into your body. You want to make sure that all of this stuff is open, your body is able to flush out kind of those toxins easily throughout your body and through your natural detox pathways, even through our skin and through our pores. So if you're doing any kind of sauna, you're sweating, you're able to push things out through those areas of your bodies as well, not just through your liver, your lymph, and your kidneys, but also through our skin. So keep that in mind as well. Now, as far as nutrition, minerals, and hydration for fertility, and before I jump into that, so my own perspective with fertility and kind of what I've personally dealt with, I've seen a lot of people, I think, in and around this field that have noticed impacts similar to my own, where you are noticing more and more men and women at younger and younger ages are having issues with fertility. And there's a lot of factors that go into it. For my own issues with fertility, I noticed jumping into the life of EMS, high stress levels, regular sleep habits, lots of night shift work, poor diet, a lot of fatigue, especially taxation on your central nervous system when your body's constantly in a fight or flight state, and then exposure to certain chemicals and medications and gear on a consistent basis. We look at firefighters too, and we look at the exposure to a lot of these PFAS and these forever chemicals that are in their gears, and then as well as like the on-the-job toxins. So there's a lot of impacts that people see in and around fertility. And then also with hormone replacement therapy, there's a lot of people that are in very young ages that are noticing lower and lower testosterone levels or other hormone levels in their body. And then they are obviously put to a position where they need to start supplementing these. So that was my issue. I noticed that with poor sleep and high levels of stress and diet, my testosterone in my early 20s was in the low 400s. So very, very low, really kind of big impact. And so I personally had started on testosterone cypionate, just going through injections of those, and made a substantial difference in my life. I started noticing that I had improvements in energy and improvements in drive and in libido and all of these major, I think, areas that a lot of people can lose. So the testosterone replacement area, I've seen and personally experienced, there's a really, really incredible benefits with it. If you're a man and you're listening to this, we see a lot of times what happens is men that go on to testosterone, it can shut down their body's hypopituitary axis, or that hypothalamic pituitary axis, which is basically the axis that communicates between our brain and the signals that are being received to produce more of these hormones. So, essentially, our nervous system is constantly signaling back and forth between different areas of our body. When we look at pain, and we look at pleasure, when we look at anything, all the way down to our hormones. And so our body is basically trying to maintain what is known as homeostasis, or a level of balance. And we have certain levels that need to be regulated, right? Our body, to maintain homeostasis, we have certain levels of thyroid hormone, certain levels of estrogen, certain levels of testosterone, even in men. Men, estrogen is very, very important as well, especially when we look at healthy bones and cholesterol levels. So testosterone is not the only factor for men, but I will tell you what happens is, as we start taking exogenous hormones, we do have the ability not so much to cause a decline in the body's natural testosterone so much as we more have an issue with shutting down our body's communication system. Um, I think it's easy for men to, if they're going into it with this perspective, to keep those pathways open, to protect their body's natural free testosterone, natural testosterone production. And so when we look at the administration of testosterone and its ability to shut down that communication pathway, the reason it does this is typically our body is receiving these signals and it's saying, okay, we're low. We need to increase production. We need more testosterone. And when our body is getting plenty of it from outside, now we're giving it exogenous or outside of the body testosterone, our body is now saying, hey, we don't need to necessarily keep this signal open. And it essentially hangs up the phone. And so, one person might be trying to call out and no one else is picking up the other line. And so that is our body's natural kind of communication system. That isn't necessarily a bad thing. It's a natural thing, especially as we get upper in, in age and in life. Our body's natural testosterone levels are going to decline. All of our body's natural hormone levels are going to start to decline when we look at testicular and ovarian hormone production. But it is very important that if you are a young male and you are trying to, or at some point in the future, wish to conceive, then as you start going on forms of testosterone, it is important for you to make sure that you are watching your fertility levels. So I wish I had known this back before I started testosterone to get a really good baseline. But I will say, for young men, before you jump on testosterone, it is not a bad thing to get a fertility test done, to look at your sperm's quality and morphology and see what is your body's natural percentage or volume of sperm that is active, and what does that quality look like? Because I can tell you, ideally, most men should be at what they classify as an ideal number is 40 million sperm active per sample. If you're below that number, we see a lot of people that start venturing down below 5 million, and right around that 2 million mark are becoming what could be classified as infertile. So 40 million is great. You should be above, usually between 10 to 15 million as kind of the minimum. And the lower and lower you get, the harder of an issue you're going to start noticing when it comes to conceiving. And so if you're a young man and you're looking to get on testosterone, I highly recommend getting a starter kind of fertility test done to see where your natural fertility is without testosterone. And that is a great comparison, because then if you go on testosterone for a number of years, kind of where your baseline is at. It's great to have a test done every year. It's also fantastic if you're young right now and you get that test done and you're at that 40 million mark, even though your testosterone is low, to get some of that cryopreserved. So that way in the future, if you ever do need to have IVF or anything like that done, you have a sample that's stored, and they only need one viable sperm to be able to utilize to fertilize an egg. So you have some great options there, and it's a great way for any men that are kind of starting testosterone replacement therapy and want to preserve that. The other thing too that you can do is there's a lot of alternative medications. We'll talk about HCG and HMG in this episode too, and then of course just naturally trying to boost testosterone production through a number of different supplements, decreasing toxicity. There's a lot of men that can really improve natural testosterone levels. There is still a very strong argument that at some point in time, you're going to start noticing a percentage of testosterone decline where you need exogenous testosterone. But a lot of people are being forced to get on it at a younger and younger age, which is impacting that communication pathway in their brain to their glands. And we're noticing that more and more men later in life are having a harder time come off of it. So there's ways that you can, I think, improve testosterone, maintain fertility at a younger age before going on to testosterone, as well as being smart about it on how to preserve these levels and these hormones in your body if you're actively going on to it. So if you are a man that's in late 20s, early 30s, you're noticing very low testosterone levels, you want to get on exogenous testosterone like testosterone cypionate or something like that, then just making sure that you're being precautionary and you're obviously watching your levels, your blood work. FSH and LH levels are very important for both men and women. It's very important to get a luteinizing hormone and a follicle stimulating hormone test done to see if that communication pathway is still open. So when we look at your hypopituitary axis and basically your body's ability to communicate those signals and get those hormones released, FSH and LH are very important for that. We'll talk about that later in this episode too, but get that blood work done. And then even for women, when we talk about blood work and things like that, we'll do a hormone specific episode, but it's very important for women to know that when you're going through a hormone test, you want to know that your body, and this is important for men and women, is going to peak and trough at different times of the day. For one, most women don't realize that there's several estrogens. There's 3 different estrogens. There's E1, E2, E3. So if you're just getting estradiol pulled, then you're not seeing all of the estrogens. It's the same thing when somebody needs to do a thyroid test. If you need to go in and get a thyroid test done and you're only getting your TSH pulled, then you're going to notice that you're not getting a good look at those thyroid specific hormones. So look at the thyroid specific panels, not just your TSH. And then also when you're doing blood work, it's important for both men and women to understand that our peak hormone output is going to be in our early to mid 20s. And we're going to steadily be on a pretty good decline ever since then. Some of us are going to decline faster. Some of us are going to decline slower, but we are going to peak and trough at different times of the day. So my peak testosterone output might be 11 o'clock in the morning, where someone else's peak testosterone output might be 4 o'clock in the afternoon. Blood work can be inaccurate in that aspect. It is one small snippet. And for women specifically, when you take that and you also correlate it with where you're at in your menstrual cycle and how close you are to menopause, or if you're perimenopausal, there's a lot of factors that go into this. So I do encourage women, know exactly where you're at in your menstrual cycle when you're getting blood work pulled, especially when you look at hormones. I personally like the 24-hour urine hormone test better than anything because it's going to give us, there's a lot of hormones in urine. There's a lot of data that we can pull from urine, especially over a 24-hour period, because it gets all of those peaks and troughs. And so we get a very, very accurate reading of where your hormone levels are. The Dutch test is complete trash. I don't like the Dutch test. It's dried urine. It's a very small amount of dried urine at one time of day that you're putting this on this blot paper and you're sending it out. So there's a lot of factors that can go into that. When you look at a 24-hour urine test, you're collecting urine for 24 hours. It is still live and wet. Those hormones are still active in there. You're pulling that small sample and you're sending it off. And so you get much, much better data. Everyone's big on the Dutch test right now. The Dutch test is far less accurate when you look at things like the 24-hour urine hormone test. If you're opting in, if you're looking between the Dutch test or any other test, go for the 24-hour urine hormone test. I promise you, it's a far better way to look at that. And ultimately, when we talk about hormones, especially in women, a lot of times blood work can be a very big waste. There are some good times that women should be pulling blood work specifically for hormones when we're speaking about hormones, but a lot of times because of the peaks and the troughs, and there's a lot of important factors. When was your last period? How close are you, as far as menopause is concerned? So a lot of times women that are in hormone decline the best route to take is beginning hormones, titrating to symptom alleviation, and then testing to make sure that we have you at an adequate level when it comes to making enough bone and enough testosterone to protect your muscles. Your progesterone levels are accurate. You're at a high enough level to protect your uterine wall and your endometrium. So just keep that into consideration. That's a little bit of a hormone kind of dive here. So for men and women, like I said, I am not anti-hormone. I think hormones are very, very important. I think they just need to be used in the right kind of case. Hormones is a very, I think, cowboy industry. Unfortunately, right now, anyone that graduates medical school that gets a DEA license can prescribe testosterone. If you graduate medical school today, you can prescribe any hormones, outside of testosterone. So you're not a hormone doctor. So a lot of people will go to their primary care doctors or they'll go to their OBGYNs. OBGYNs are surgeons, and nothing against OBGYNs. OBGYNs are fantastic. I think there's a very important presence for OBGYNs. Primary care doctors as well. I have nothing against primary care doctors. I think they're very important in society. But most people don't know where to turn to. You should be turning to a hormone-specific doctor that specializes in men and women's hormones. So testicular or ovarian hormones, a hormone replacement clinic. Personally, I don't like testosterone replacement clinics. From a male perspective, I think testosterone replacement clinics have a place, but the model I personally just don't like as much. I think testosterone replacement clinics are a little bit too limited and controlled. It's it's not so much treating to how you feel and where your blood work looks good. It's more so treating you to a specific level, or a range, which most men and women run into, especially when you go to, like for women, your OBGYN or your primary care doctor. Going to a hormone specific doctor that specializing in ovarian and testicular hormone replacement and has been doing it to symptom alleviation and is looking at you as a patient and treating you specifically, not just looking at, your blood work's in range, which is what most men and women deal with. When they go through a kind of a hormone area, they're going to be usually finding a doctor that is either going to say, oh, well, you're too young, you don't need to be on hormones, or yeah, we'll give you a little bit, and that's kind of it. You should be treated to how you're feeling. Now, ultimately, we don't want to put you in a state that is super physiologic, where you are taking in way too much, because there is harm in that as well. But we do typically see that usually, even just looking at women, on average, 50% of them are typically on too low of a dose, even when they reach symptom alleviation. And we see a lot of women that are on hormones, they're put on an estrogen patch, or they're put on a estrogen and progesterone mix, which is really not good. If you are mixing estrogen and progesterone together, I highly recommend that you rethink that, because estrogen is an amplifier and progesterone is a relaxant. The product that you're taking for maybe easier use is really not beneficial when it comes to supporting healthy levels during the day for energy and for relaxation. So if you're still having trouble sleeping, it might have to do with that. But, a lot of women are on an estrogen patch, or they're on a progesterone cream or a progesterone supplement. Typically, there's still a bad stigma for women when it comes to testosterone. Testosterone is very important for women. Testosterone is not a male hormone, and testosterone is a hormone for both men and women. Both men and women need it, especially we look at estrogen. Estrogen is not a female hormone. Estrogen is a male and female hormone. Estrogen is very important for men. So there's a lot of, I think, poor thinking in and around hormones. Women need testosterone. It is very important when it comes to building enough muscle and protecting your brain and ultimately preserving, when we look at like things like brain fog and we look at motivation and energy and libido. A lot of people are not getting the levels that they need. So keep that in mind, but ultimately find the right kind of doctor if you're looking at hormone replacement, one that's going to take care of you, one that is going to understand that if you still want to have children, they know what direction to take, whether that is still going with exogenous hormone replacement or giving you different types of medications or supplements that are going to support natural endogenous fertility levels or endogenous testosterone levels. So find those right kind of providers, find somebody that specializes in this. Like I said, a lot of providers can prescribe these medications or these hormones. That doesn't necessarily make them a hormone doctor. And nothing against doctors. I think that there are fantastic doctors. Unfortunately, I think hormones should be a specialty. If you're going to go and see a cardiologist, you're going to find someone that's very good at their job and they've spent years getting trained specifically as a cardiologist. If you're going to go and even see a dentist, dentists spend several years in a specific area outside of medical school. And that's what I mean, learning that area. You look at a podiatrist, you look at orthopedic surgeons, you look at neurologists, anybody that's in a specialty has had additional training. Hormones, unfortunately, they don't necessarily have that expertise and that training, which they need to. So keep that in mind as well. I think that's a huge piece when it comes to fertility, protecting your body's natural fertility levels. Both men and women should be doing fertility tests. So, make sure that that you're fertile before you start any kind of hormone replenishment or hormone replacement therapy. And then even for a lot of men, I think, there are different protocols out there when we look at hormones. Some are going to be a higher level and then a lower level rotation where you're kind of cycling. Other ones are going to get you on a consistent level and leave you there, which is great, especially if your blood work looks good. So just work with someone who knows what they're doing. Specifically, let them know if you're looking for protection for fertility, and that's going to make sure that you're in a safe area and protected as you go through this routine. Now, jumping into kind of the next section, when we look at specifically nutrition, minerals, and hydration for fertility, we really need to talk food. Now, you can't build healthy eggs, sperm, or hormones from nutrient depleted ingredients. That is very important too. So what you eat is either going to fuel life or it's going to feed inflammation. And when it comes to fertility, certain nutrients are non-negotiable. So top fertility foods are going to be things like grass-fed and grass-finished red meat, which is going to be rich in B12, iron, zinc, CoQ10, and carnitine, which are very important for fertility levels. Wild-caught salmon or sardines, I prefer the salmon over sardines, are rich in omega-3s and selenium. Omega-3s everybody should be taking an omega-3 supplement. Even if you are getting food that's rich in omega-3s, make sure that you're taking an omega-3 supplement. It's also kind of like a vitamin D supplement. Those two go hand in hand. We'll also talk about, when we talk about your body's natural insulin response, berberine is a fantastic supplement too. Kind of its topic for a different area, but alpha lipoic acid and berberine, that's another supplement that just about everybody should be taking if you're worried about stomach fat or insulin resistance. So eggs with yolks are going to be important too. A lot of people eat egg whites, but if you're trying to improve your fertility levels, something that's rich in choline and fat-soluble vitamins like vitamin A, D, E, and K2 are going to be within the yolk. So, switch for a whole egg versus just an egg white. Things that are rich in that higher levels of fat like avocados, olives, coconut oil, those clean fats for hormone production. And then pumpkin seeds, Brazil nuts, things that have that high rich form of zinc, selenium, and vitamin E. That vitamin E supplement is very, very important, especially when we look at other antioxidants. A lot of people speak about things like NAD and glutathione and vitamin C, but vitamin E is very, very important when it comes to our body's natural kind of recirculation and basically the reusing of these antioxidants in our body. So I would get on a vitamin E supplement. If you're looking at taking things like I mentioned for that antioxidant support, vitamin E is very important for that recirculation and that replenishment of those antioxidants. And then bone broth, root vegetables, fermented foods, those basically are going to nourish the gut and they're going to be very mineral rich. I would avoid foods that are very pesticide heavy, things like, your Dirty Dozen, make sure you get those as organics. Glyphosate sprayed grains, so choose organic, gluten light, or sourdough. Sourdough is fantastic. I would definitely opt in if you're looking at a bread, opt into sourdough. That Lactobacillus reuteri is a very important bacteria that we talked about earlier for your gut. Factory farmed meats and dairy, definitely avoid those. Those are obviously going to contain typically hormones and antibiotics. A lot of companies are getting around the labels in several different ways. So I would just really take pride in the types of meat that you're buying. And then I would avoid seed oils, so canola oil, soybean, corn, things that are pro-inflammatory and pro-hormone disrupting. So those oils do have an impact in your body. If you're looking for really good things to use to cook in, beef tallow, ghee is a fantastic high point cooking oil. When you look at things like avocado oil is great, but it's great to be eaten raw. So if you get that organic extra virgin olive oil, it's fantastic for your body. I would eat it on salads or eat it raw, but ultimately cooking a meat kind of in its own fat is going to be the best kind of source of an oil to be using. I would stay away from canola, stay away from any kind of corn oils, and olive oil isn't the best for heating. So looking for a high smoke point oil is going to be kind of your best friend when it comes to that. So, and then your tap water. Make sure it doesn't contain fluoride or chlorine or any pharmaceuticals. Get a good water filter. Make sure that your water is really clean. Those are things that I would be essentially avoiding and keeping clean on a consistent basis. And then hydration and minerals, making sure that your filtered water, which is essential, but typically filtered water is still lacking minerals. So, when you get a reverse osmosis filter, it's going to strip a lot of those important minerals with the toxins that it pulls out. So be sure to add trace minerals back in. You can get Baja Gold sea salt, you can get the Baja Gold mineral drops, but basically you're replenishing things like sodium, magnesium, potassium, and then a lot of other trace minerals that are going to support your adrenals, your mitochondrial and your mitochondria and your hormone function. Those are easy just by taking literally a quarter, an eighth or a quarter of a teaspoon of Baja Gold sea salt, which is right around 500 to 1,000 milligrams, is going to not only help your body to retain more water, keep you hydrated longer, it's going to support tissue hydration, and it's also going to obviously remineralize your body, especially with over 90 different trace minerals. A lot of migraines we even see on a consistent basis are people that have an irregularity in their sodium and water balance. So that dura that surrounds our brain is very sensitive when it comes to sodium levels. And so if we are in a low salt level, which a lot of people are, we drink a lot of water or we don't drink enough water, we're still exercising, we're flushing out a lot of those electrolytes, especially our sodium, that dura is going to contract around our brain. And unfortunately, we're going to start noticing more and more headaches. Anyone that can just literally start increasing their sodium and their water on a consistent basis is going to start noticing a majority of their migraines is going to dissipate. Keep that in mind too. Add a little salt to your diet. A lot of times salt gets a very bad rap, and we see more and more people are told to stay away from salt. Salt is actually very important for our body. We even see a lot of times blood pressure can go up because we don't have enough fluid that's being retained in our body and in our cells and in our blood. Chronically dehydrated, as you start reintroducing this water into your body and you start even just adding a sodium supplement, you're going to start noticing that your body's holding on to it. Your blood's not going to be as thick. You're going to have a better kind of hydration status in your body, especially in your tissues and in your cells. It's going to thin out your blood a little bit, make you feel a little bit better, help with circulation. Now, as far as core fertility supplements, things that I would recommend that people should be taking on a consistent basis, here's really where we get tactical. And these are the most important evidence-backed fertility supplements that both men and women should be taking. So for women, methylfolate, not folic acid. We talked about this earlier, but especially most women, like I said, typically we're 40% of people, and even now we're seeing it's closer to 60% of people have what's called the MTHFR gene mutation. So you cannot convert folic acid to methylfolate if you have this gene mutation. So methylated B vitamins, especially methylfolate or methylcobalamin, are very important when your body is getting these nutrients in. So get a methylfolate supplement, not a folic acid supplement. CoQ10 in the ubiquinol form is basically going to improve egg quality and mitochondrial function. So get a really good CoQ10 supplement. Choline as well is going to support your brain and your fetal development. Choline is a fantastic supplement. In my opinion, everyone should be taking a choline supplement. Basically, what we start noticing, a lot of Alzheimer's medications is actually using supplements or using medications that are increasing acetylcholine in the brain. So acetylcholine, choline. What we want to try and do is to reduce acetylcholinesterase, which is what a lot of these supplements do, where they are basically blocking a acetylcholinesterase, which is what breaks down acetylcholine in the brain. So anytime that we can increase that neurotransmitter is going to be very important for higher level thinking, for neuroprotection, for cognition. It's going to support that brain development, especially in children. But look at that supplement. I think most people should probably be on that. Yeah, the alpha GPC supplement is a much more bioactive form of choline. And there's a lot of great companies. Mentis is a really good brand. There's a lot of other companies that are going to have great forms of it too, I'm sure. So I love that supplement. I don't take it at night because it can definitely give you a lot more energy and keep your brain awake. So taking it in the morning is fantastic for cognition. We talked about omega-3s, but DHA, EPA lowers inflammation, supports ovulation. Vitamin D3 and K2. So vitamin D3 and potassium is very important for hormonal balance and implantation. So vitamin D supplements, if you're really low in vitamin D, like if you're below 30 for vitamin D, I would get on a weekly vitamin D injection. I've spoken about this before, but you can begin making yourself sick as you start taking too much vitamin D orally. You can put yourself into a vitamin D toxicity, which is basically equivalent to a calcium toxicity. We start noticing people that take too much vitamin D, they start flushing calcium into their cells and they start getting really bad nausea, vomiting, diarrhea, lethargy, arrhythmias. So you don't want to overload your body with calcium by taking too much vitamin D. I would get on a a vitamin D injection that is easily digestible, something that your body can use up very quickly, and an injection that you do once a week if you're really low, or once a month every three to 4 weeks if you're at a normal level. So above 30, typically for most people is a normal level, is going to maintain healthy vitamin D levels. So vitamin D, doing a weekly injection if you're low. My vitamin D was at 15 for a while, very low. I started taking a vitamin D injection and got it right up. So the injections are fantastic. A magnesium glycinate, so it's going to calm stress, support your hormone production. And then when you look at NAC, or acetylcysteine is the other name for it, and then glutathione, those are going to detox and help with egg protection. So when we look at opening up our liver as well, acetylcysteine is still a fantastic supplement to take. So if you're putting castor oil packs on your liver, you're trying to open up your detox pathways in your liver, acetylcysteine is fantastic, as well as dandelion root. So for your liver and for your kidneys, the opening up those detox pathways, both of those are fantastic supplements. Glutathione is fantastic as well. Acetylcysteine is the precursor to glutathione, so it's going to help your body to produce glutathione. But glutathione is a fantastic supplement for healing the body, especially when we look at our skin, when we look at just our cells in general. It's a fantastic detoxifier too. Works more as that healing agent and that recovery. So even taking acetylcysteine and glutathione together, fantastic. I like acetylcysteine because it's going to help and promote your body, not only as you naturally detox with it, but also as it promotes glutathione, you're going to get lasting benefits too. So you kind of get a dual benefit with acetylcysteine. But I take both. I love glutathione and acetylcysteine together. I think they make a fantastic synergistic pair. You kind of hit it from both angles. So, and both of them are great through the IV too. You can get a lot of those supplements through the IV at much higher doses, especially if, we start talking about autoimmune issues. We look at things like Lyme's disease or things where you want to detox your body more. Both of those supplements are fantastic for Lyme or any other autoimmune issues. So going to an IV clinic and getting higher doses of those, even like 400 milligrams of acetylcysteine, anywhere from 1,000 to 2,000 milligrams of glutathione, both are fantastic kind of dosing recommendations for people through the IV. Now, for men, zinc and selenium are really important when it comes to sperm motility and morphology. Carnitine or L-carnitine and CoQ10 are going to support mitochondrial health and sperm quality. Ashwagandha, which is probably one of my favorite supplements, especially when it comes to sleep. It's going to lower cortisol and it's going to support natural testosterone production. Sleep is a huge component. Both men and women, if you are struggling with sleep, do some of the stuff that we've talked about when we look at grounding and reducing stress. A lot of people that want a really great supplement, Blue Lotus tea is fantastic for a sleep perspective. I love Blue Lotus tea. I think that it is one of those things that will help you substantially with sleep, and ashwagandha as well. I mix those two together and talk about the best lasting sleep that you can get. You get it organic Blue Lotus tea. It is fantastic at also detoxifying your pineal gland as well, and it will put you right to sleep. You'll get lasting sleep. Get the whole flower. When you get Blue Lotus tea, you can get it in grounds, you can get it in a mix, but basically you just soak it in some water for 7 to 8 minutes and just drink it like you would any other tea. And I wouldn't do more than a tablespoon at a time because it is very, very strong stuff. So tablespoon mixed in some hot water right before you go to bed is fantastic from a sleep perspective, and it's definitely going to benefit lowering cortisol, boosting testosterone, natural circadian rhythm, helping with your body's natural fertility regulation, and then boron as well. Boron improves free testosterone levels. Boron is also a really good detoxifier. It's a fantastic binding agent. So you look at utilizing boron with fulvic acid and with activated charcoal. So boron, activated charcoal, and fulvic acid are great binders and detoxifiers for the body. And you can get it in a detoxifying agent. I actually have one that I recommend to most people. And that's a kind of a dual benefit right there. You're getting a detox and you're also getting benefits for your testosterone levels and fertility. Now, NAD plus boosters, so like nicotinamide riboside or NMN, are also promising for egg and sperm production and quality, especially as we age. So these compounds fuel mitochondrial energy, which eggs and sperm depend on for essentially division and fertilization. So when we look at the ability for our sex cells to split and for that DNA and those chromosomes to be able to essentially be donated for conception, for procreation, our body needs the ability to go through every metabolic process. We have mitosis and we have meiosis. So the ability to split cells, specifically when we look at the ability to conceive, the splitting of our sex cells takes a lot of energy. And we want to be able to donate those chromosomes in a specific way. And so for our ability, even when we look at splitting and replicating normal cells, our body requires a lot of energy to do this too. So we need a lot of our mitochondria to be very healthy. Nicotinamide riboside and NMN are the precursors to NAD. They are going to boost that form of cellular energy, and they're very, very important for ATP. So we see that NAD specifically in the cell is responsible for over 90% of our cellular energy, that ATP production, and that comes through natural metabolism, right? So in our Krebs cycle, our body's ability to basically take and convert sugar into pyruvate and then try and continue to convert that all the way into cellular energy, which is ATP. In that process, our body is essentially releasing and producing NAD, and that NAD is a huge component for the NAD process. So in that, nicotinamide riboside is the more bioavailable and closer active form. There's a lot of great benefits with NMN. NMN has to go through a lot of other processes to become NAD. NAD is too big to get in the cells. So nicotinamide riboside, or NR, is right in the middle. There's a company called Niagen. I really like Niagen. I think they have a fantastic supplement with a lot of great research behind it from a nicotinamide riboside perspective and giving the body greater energy, more ATP. I've seen from an IV perspective, a lot of both men and women have had fertility issues that have come into our clinics that have done a series of NAD infusions. They have to be done in a very specific way. So I do recommend doing your research. Most people don't realize NAD has to be done over, really 4 to 6 hours is the most ideal. Most people should be doing it over 6 hours. We don't even see blood or tissue levels elevate from NAD until after the 2-hour mark. So there is research that shows it has to go in really over a minimum of 2 hours. And then when we actually compare that in the data, a 6-hour window is very important, especially when you look at Herxheimer's reactions, which is why I tell people before you start taking NAD or any of these high level of antioxidants, you need to open up your detox pathways, or as soon as you introduce these compounds into your body, you're going to notice a flood of toxins, and then they're going to get reabsorbed back in the cells, and you're going to get a bad Herxheimer's reaction, and you don't want to feel sick. So make sure you open your detox pathways before you begin those supplements. But even doing NAD infusions 4 to 6 hours at a time, back-to-back days, they need to be done very specifically. So find a place that does NAD in that kind of a realm. You're going to get far better benefits. And the Niagen is fantastic as well. Niagen can go in at a far, far faster rate. I think Niagen, like I said, is going to enter the cells much, much easier. You're going to get a lot great lasting benefits from Niagen. And then they also have it in an oral form. So you can get Niagen through the IV. You can get Niagen as an oral form. If you're taking it as an oral supplement, they have different dosing levels. I will let you know that NAD, NR, these are all very similar to niacin. So if you get really bad niacin flushing, you have a sensitivity to niacin, which is a B vitamin, I would just err on the caution. Take a little bit of a lower dose, work yourselves up to the higher dose. Orally, 1,000 milligrams is the high dose. So starting at 100 or 300 milligrams at a time is fantastic. And then working your way up to 1,000 milligram dose is a better way to go. Now, as far as environmental toxins, cookware, plastics, phthalates, those things that we've talked about before, we really want to start diving into exposure. So as we start talking about exposure, because truthfully, even the healthiest foods can't undo daily contact with hormone disruptors that come into our home and come in just daily exposures. So common fertility disrupting toxins, we look at BPA, which is found in cans, plastic bottles. It's on receipts. Receipt paper can be very toxic too for a lot of people. So just be careful how much of that you're touching and crumpling up and rubbing together. Phthalates, which are synthetic, they're in synthetic fragrances, plastics, lotions, cleaning products. The microplastics, which are going to be in tap water, bottled water, low-grade cookware. We've talked about Teflon and PFOAs, which are those forever chemicals. Those are going to be in your nonstick pans, your takeout containers, your food wrappers. So these xenoestrogens are basically fake estrogens that interfere with our own hormone signaling, and they're linked to early menopause, PCOS, endometriosis, low sperm count, poor egg quality. The list goes on. So if you're trying to improve your fertility, you need to get these things out of your body and out of your daily routine. So what to swap? Basically, you should be using stainless steel, cast iron, or glass cookware over anything that's like plastic or Teflon coated. Store food in glass, not plastic, especially reheating it, or anytime you scratch it, those microplastics get released. You don't want that being essentially scraped onto or leached into your food. Plastic cutting boards is another one. Get a wood cutting board. Get filtered tap water, especially if you're using a reverse osmosis system, like AquaTrue or Clearly Filtered. There's a lot of brands that you can use for that. You can under the counter one, you can get an over the counter one, you can get a whole house filter. Just at least the kind of water that you're consuming on a consistent basis needs to be filtered. Our skin is one of the most highly absorbent areas of our body. So if you can find a lot of very cheap whole house water filters that are reverse osmosis on Amazon that you can, essentially filter all the water that you're even going to be showering with and bathing in. So I would look at those. Those are the kind of the best way to go. Remineralizing that water is important, or I would choose fragrance-free personal care or brands that are like Primally Pure, that are very, very good natural brands that are using organic ingredients that are taking care of your body and not putting phthalates in them. And then avoid eating, or heating food in plastic and Teflon pans. So easy swaps right there to keep your body healthy and improve your fertility levels. The other one that I want to talk on is a little controversial. What we're about to speak about is hormone birth control and its impact on fertility. And I know this is a sensitive topic, but it is too important to skip, especially from a fertility perspective. Hormonal birth control has revolutionized women's autonomy, and I get that. But many are unaware of how it impacts their fertility after they stop using it, and even while they're using it. We've talked about how when men go on testosterone, it shuts down that hypothalamic pituitary axis. Same thing happens with women. And birth control specifically suppresses ovulation. It's going to alter your vaginal microbiome, and it's going to change cervical mucus, which can take months or years to fully recover. And that bacteria is very, very important when it comes to your fertility. They're also going to deplete key nutrients like folate, B6, B12, magnesium, and zinc. They can also mask underlying hormone imbalances like PCOS and hypothyroidism. And prolonged use can increase infertility, anxiety, depression, and even loss of libido. So hormonal contraceptives are very, very toxic for people. So if you are planning on having kids at some point in the future, you want to have children, I would avoid hormonal-based birth control. I would do cycle timing, track your ovulation, make sure you know where you are in your menstrual cycle, and practice abstinence, or using things like condoms or other methods are going to be far safer than it comes to taking a hormonal-based contraceptive, which is going to impact your hormones, your fertility. When we look at things like the Depo-Provera injection or even oral-based hormones, they are affecting so many things in our body. So when we look at the pharmacokinetics and the pharmacodynamics, most combined oral contraceptives deliver synthetic ethanol, estradiol, and progestins that downregulate your GnRH, your LH, and your FSH, which effectively suppress the brain's hormonal signaling to your ovaries. So just like what we spoke about when it comes to men and the ability for the brain to signal the testicles to produce the right amount of sperm and get healthy testosterone production, our body is now getting that interruption in the same exact communication signals that are basically telling women's bodies the same hormonal signaling to your ovaries. So when we look at follicle stimulating hormone, luteinizing hormone, these are directly showing that hypopituitary axis. So that hypothalamic pituitary ovarian axis specifically for women, hypothalamic pituitary testicular axis for men, they all basically have to reboot after the discontinuation of any of these hormones. For women specifically, when we're looking at hormonal contraceptives, this process can take anywhere from 3 to 12 months or even longer, depending on your body's nutrient status, the inflammation, and your stress levels, as well as the buildup. So what a lot of people don't realize is a lot of these things can build up and essentially produce a storage in our body for a lasting period of time, which is also why if you have been on a hormone-based contraceptive and you are now off of it, for one, as you come off of it, you're going to notice there's a lot of things that have to re-regulate in your body. Your mood, your energy levels, your motivation. We start looking at your nutrient levels. We start looking at your body's natural absorption of things. A lot of your body has to go through a number of different changes to re-regulate, but we're also noticing that your body has to go through a time where essentially it needs to reduce all that inflammation and you need to detox. And so when we've talked about detox, if you're coming off of a hormonal-based contraceptive, now is the time to start doing a detox in your body. Start flushing stuff out of your body, especially out of your liver. If you're taking a oral-based hormonal contraceptive, flushing your liver out is going to be very important. So some really great recovery tips. We've gone through, obviously, detox. We've talked about rebuilding your gut's natural biome, but support your ovulation with Vitrex. So anything like castor berry, maca root, seed cycling is very important too. Rebuild your gut flora, reduce your inflammation inside of your GI system, replenish those nutrient stores, especially your methylated B vitamins, and then track your cycle and your hormone levels to identify when true ovulation returns. And that's going to take some time, right? But you need to really track how you're feeling on a consistent basis, your menstrual cycle, and use some of these apps that can help you to know how you're going to be feeling and start seeing how your body consistently re-regulates. And that's going to help you obviously get all of these practices back on point as you start to re-regulate your body, your central nervous system, your hormone cycles, and your nutrient absorption. So if this is you and you're in this boat, this is going to take some time. I am here to answer any kind of questions that you have. I have helped a lot of other women through the exact same process, including my own fiance. So I've noticed that there's a lot of questions, there's a lot of concerns, there's a lot of people that, especially women that are going through this type of a detox, are coming off of hormonal-based birth control and not understanding, is this normal? What's not normal? I want to help you. But this is a really important thing to consider. And if you're somebody who is currently on hormonal-based birth control and you want to have children in the future, I recommend looking at alternatives, because the earlier you can get off of it, the earlier you can start researching these things, taking care of your body, the better off that you're going to be, especially when it comes to the point where you actually want to start having children. So if maybe that's a year, maybe that's 5 years down the road from now, there is a re-regulation period that your body has to go through before you can actually conceive. So, and that goes through the detox process. And if you want really healthy children, which I'm sure just about everybody does, your body needs to be in a very healthy state. So now is the time, if there's even a possibility that as you're coming off of hormonal-based birth control that you might want to have kids in the next year, now is the time to start getting yourself very healthy with the food you eat, with the supplements that you're taking, with the toxins you're exposed to. Start getting your body very healthy, start detoxing these things that are sitting around in your body, causing inflammation, causing bloating, causing weight gain, causing brain fog, irregularity in mood. Get all of your body very clean. Also for men make up a very large percentage when it comes to healthy birth rates. So men should be taking 6 months to a year plus and getting their body as healthy as possible as well. We see women are having more increase in nausea in that first trimester. We see women are also having disruption when it comes to the actual fertilization process. And then when we also look at miscarriage rates, there is a direct link between men's health, sperm quality and morphology, and all of those factors. So men need to be taking care of their health. They need to be making sure their body is producing healthy motile sperm before they start going into having children. And that also goes into when we look at birth defects and autism rates and things like that. Having healthy genes and healthy cells is important when it comes to reproducing. So take pride in your health, get out, exercise, be healthy, get your body fat down, get your hormones regulated, make sure that your body is in a good position before you try and have kids, and you're going to notice a substantial difference. So the next kind of tip that I want to jump into comes into peptides and for fertility medication. So this is really where I want to bridge the natural-based therapies that we're talking as well as the pharmaceutical-based therapies. So for many, natural and lifestyle-based support isn't enough to restore fertility. And for a lot of people, those facing clinical infertility and long-term suppression of their body's natural hormone and fertility levels, pharmaceutical and peptide-based therapies can be game changers. So let's break some of these down and do it in plain language so you know what to understand. So Clomid is one medication that a lot of people are probably familiar with. If you haven't heard of Clomid, so Clomid or clomiphene citrate is a selective estrogen receptor modulator, or a SERM, and it is used often to stimulate ovulation. Basically, how it works is Clomid tricks the brain into thinking estrogen is low by blocking estrogen receptors at the hypothalamus. This promotes the release of GnRH, which then increases your FSH and LH levels, which triggers ovulation. So it starts to open up that communication process. So it essentially is telling your body now, we used the analogy before that somebody's calling and nobody's picking up the phone on the other end. What this is basically doing is allowing your body to send that communication out and get someone on the other side of the phone to pick up the line. So that way your body starts opening up these natural metabolic processes that it's supposed to. The half-life of this medication is about 5 to 7 days. The common protocol is right around 50 to 100 milligrams for 5 days. Starting day is usually 3 or 5 days of the cycle. Risks, you're going to notice mood changes. You're going to notice, you can develop ovarian cysts. You can develop thinning of the endometrium with prolonged use. Clomid is, it's good for women who aren't ovulating regularly. If you have PCOS, if you have essentially that hypothalamic pituitary axis dysfunction, it is good to start opening up those pathways. Clomid is hard. Men can take Clomid as well. It does work in a similar process to kind of help men to trigger that FSH and LH level to start producing testosterone, which is why men will normally take an aromatase inhibitor while they're on Clomid. An aromatase inhibitor prevents the breakdown of testosterone into estrogen and prevents that elevation in estrogen levels, which is why when men are on testosterone, most testosterone injections are given once a week or even twice a week. And you're going to have highs and lows in your testosterone levels, and you're going to start noticing aromatization, which is going to promote higher estrogen levels, which is why men can develop breast tissue or gynecomastia from that aromatization. So they start developing some of these side effects. This is very common in men that do very high dose testosterone, or they're not doing it on a frequent enough basis. Most men, truthfully, that are on testosterone should be doing injections every day or every other day, even of testosterone cypionate for adequate levels. Because normally what happens is men will get this too far out. They give them a very high dose to try and get their levels up, and then they keep giving them high doses, and they're going through this cascade where if they're trying to keep them here, their goal is to get them very high. And then as they dip back down, they try and get them high again. So that way they're consistently at a level that is where their lowest is at is consistent and still makes them feel good and is maintainable. That change is where you're going to start noticing changes in your estrogen levels as well. Estrogen is going to go up, estrogen is going to change. Our body has to maintain a balance. For men and women, it's different, but there has to be a balance in levels between testosterone and estrogen in both sexes. So if one of those levels is off, the body's going to attempt to compensate as well, which is another factor. So we just talked about how Clomid is a selective estrogen receptor modulator, and it basically tricks your brain into thinking that estrogen is low by blocking estrogen receptors at the hypothalamus and releasing, obviously, these hormones that are going to increase FSH and LH and trigger the production of these hormones, getting your body back into a state like it's supposed to be in. So men will then take aromatase inhibitors to prevent and block the estrogen levels from getting too high, keep them at a low level as our body's getting tricked into thinking it needs to produce more hormones. And so testosterone goes up, estrogen stays low. We get back to that ratio of testosterone and estrogen that we're supposed to be at. Clomid, unfortunately, is very rough when it comes to mood. It's very hard on the brain. There's a lot of people that notice this essentially like depression while they're on it. So one of the factors when it comes to taking Clomid. And clomiphene is a newer, more targeted version of Clomid. It is often more used in men than in women, and it is far better, especially when it comes to, when we look at men specifically, and clomiphene increases FSH and LH, which is going to stimulate testosterone production and sperm development without suppressing endogenous testosterone like TRT does, which we spoke about earlier. So clomiphene is still going to open up that FSH and that LH pathway that you need to help increase testosterone production. It's far better on the body than when we look at Clomid, and it has a half-life of about 10 hours. So most people are taking it twice a day, less estrogenic and less side effects than Clomid. It's good for men with low testosterone, low sperm count that are seeking to preserve fertility. So it is a good option there. And usually that's used in conjunction with the next one we'll talk about, which is HCG. So human chorionic gonadotropin, which is often called the pregnancy hormone, and HCG mimics LH. You can also get an LH supplement, but in men, it stimulates essentially these Leydig cells, which are going to produce testosterone. They're going to support sperm production. And in women, we specifically see that it's used to trigger ovulation and support luteal phase hormone levels after the IUI IVF cycle. It's used in combination with Clomid or FSH in fertility protocols, and it's injectable only under the supervision of a physician. So There are some great benefits with it for men, especially too. I will say that there's an important piece to keeping that, that hypopituitary communication open while you're on exogenous testosterone replacement. And this is a great way to do it. HCG is also fantastic if you're a young man who, is going through a fertility protocol or you still want to have children in the near future. This is a great way to boost natural testosterone, boost your sperm count, and support natural fertility levels without taking an exogenous form of testosterone. The other one that goes hand in hand with this one is HMG. So this is human menopausal gonadotropin, and it is a combination of SH and LH. And it's used in both men and women when the pituitary isn't producing enough hormones naturally. And so in women, it helps mature multiple follicles before egg retrieval or timed ovulation. And then in men, it helps simulate spermatogenesis alongside HCG. If you're trying to, obviously, you're in the process of a fertility protocol, you're trying to get pregnant, especially for men that are dealing with issues in sperm count and morphology. Spermatogenesis is a key factor, which is where HMG, HCG, and enclomiphene are typically the three most important medications when trying to reopen this hypothalamic pituitary axis. And then there's also gonadorelin, which is basically a synthetic GnRH hormone, which is what we talked about earlier, but it basically mimics the natural pulsatile release of GnRH to stimulate FSH and LH, that release of that follicle stimulating hormone, the luteinizing hormone. So it's more commonly used in functional medicine and research settings. It helps to restore natural signals from the hypothalamus, especially if it's used. It's really very helpful post-birth control or in hypothalamic amenorrhea. So as a disclaimer, always work with a fertility specialist or an integrative practitioner when you're exploring these therapies. These peptides and hormones are powerful, and they should be used with professional guidance and testing. But I will say, a mix of these are great. We talked about, how women are trying to detoxify their body and they're trying to reset post-birth control. The one we just talked about, gonadorelin, is a fantastic one for that. Get the advice of a fertility specialist, work with somebody directly. But I do think that these have a major play when it comes into fertility protocols. Dosing can be very high. I think a lot of people, even in men, there's a lot of providers that will prescribe 500 to 1,000 IUs a week of HCG, where we see if that hypopituitary axis is closed down, a lot of men should be taking anywhere from 1 to 3,000 IUs every other day. So we're talking about a substantial difference from 500 to 1,000 IUs a week up to 1,000 to 3,000 IUs every other day. So now we're looking at anywhere from, 4 to 12,000 IUs consistently. I've personally taken higher doses in that range and seen a pretty substantial benefit when it comes to testosterone and fertility. And we look at sperm morphology and production. There are benefits to having a higher dosing of these medications like HCG, HMG. HMG is much more expensive. If you can work more towards HCG or gonadorelin. Gonadorelin, I think, isn't as effective as HCG. I think it's great if it's used in conjunction with, especially with enclomiphene. Clomiphene, 25 to 50 milligrams a day is pretty standard, and most men are going to see a pretty great benefit with that. Like I said, all these medications have to be prescribed. Find somebody that is going to work with you and get you on an adequate fertility protocol. And then really one of the final pieces to kind of speak on is going to be the emotional and spiritual health for fertility. So there is a part that doesn't get talked about enough, and it has to really do with the fact that fertility is not just physical, it is also deeply emotional, spiritual, and energetic. So trying to conceive can bring up shame or fear or guilt, grief, even relationship challenges. And all of this is going to affect your nervous system, which in turn is going to affect your fertility. And so I do recommend, as you're going through this, making sure that you're journaling, you're meditating, you're getting breath work in, prayer, get your body to enter that parasympathetic or rest and heal state, somatic release or body work to clear out trauma stores, especially in the womb or the pelvic floor for women. When we talk about journaling and visualization, this is going to help your body to really rebuild the trust and call in the future you that you kind of desire. I think manifesting is a huge piece in this. And then community, because honestly, nobody should be walking through this journey alone. So You're not broken. You are not too late. Your body wants to heal, and you are worthy of the life that you are creating, even if it hasn't arrived yet. And you should be repeating affirmations like that on a consistent basis, giving your body that form of positivity and directing your mind and your body where you want it to go. And there's a lot of research in that, especially in and around epigenetics. So we'll talk about manifesting, we'll talk about visualization, we'll talk about mental health, but that is an important aspect. If you have a lot of trauma, most people do, and you're trying to reset your body and get your levels on point, mental health is an important component. Your brain is very powerful. I always recommend everybody should be going to counseling, go into therapy, get help, find somebody that's going to work with you that has the same beliefs and the same cultural values that's going to help you, that you relate with. But speaking about things, most people have trauma that they just don't recognize, they don't speak about, that's hidden, it's buried up under the rug. So get in, speak with somebody. It was life-changing for me. I had a lot of trauma and a lot of things that I dealt with from the industries that I've worked in as a paramedic, and especially childhood trauma. Everybody has that. Everybody is that scared 8-year-old that just wants to be accepted. So finding your inner child, being able to basically, I think, decompress and get your body on a level where you're in that healing state, and finding some self-love is important for your mental health. When we look at your body's neurotransmitters, when we look at your body's nervous system, all of that is, these communication pathways are important and they have to be healed. And if you have a lot of underlying trauma and unresolved issues, it's very difficult for your body to get back into that reset state that it needs to. So see a therapist, go to counseling. I think everybody should. If you're in a relationship, if you're looking to get married, I highly recommend going to some kind of a couples counseling. As a man, it is life-changing, especially because more for your partner than anything. For one, because there's a lot of stuff that you don't realize that you have buried that is impacting you. It's impacting your outlook, it's impacting your communication, and there's a lot of just expectations that people don't convey. And it's hard when you're in a relationship because that person, when you don't outwardly express those expectations, then they are going to let you down every time, because that person that you're in a relationship with does not know them. So going to counseling, getting on an even footing, opening up that communication and allowing you and your partner to speak and release a lot of those things. I know for me and for my fiance, a lot of that stuff was things that she never knew that I had dealt with and experienced. And unfortunately, in medicine, fire service, and a lot of careers that I've been in, it is very much like men are not allowed to show emotion. It is basically, this is the job, deal with it, get over it, don't talk about it, shove it down. And it is a way that you really build up toxins. And trauma is just like anything else that we talk about on this podcast. When we talk about those things that can build up in our body and cause detrimental issues to our health, trauma is just like that. It is a toxic burden that your body was never meant to handle. And it is very important to release trauma and do it with somebody that can guide you through it and direct you, so you know how to not only process that for yourself, but also for your partner. It shows them, what is it that you're going through that is disrupting your communication or giving you these preconceived notions of maybe what your partner's expectations are. I think a lot of times we don't communicate because we already think that our partner's going to think something about us, or they're going to say something about us. And we jump to conclusions. We assume too easily. And a lot of that has to go with a breakdown in communication and our own self-doubt and our own bad habits and preconceived notions, which above all else comes down to self-love. You have to be able to enter an area of self-love to be able to heal and to reset your body and get to a stable pillar, right? We have so many pillars in our lives. We have pillars in health. We have emotional pillars. We have spiritual pillars. Have so many areas that come into our total vitality. And that is a big one. Finding self-love is very important. And so if you look at anybody that is troubled, they are maybe narcissistic, they have a hard time admitting when they're wrong, they're very confrontational, they're not conflict avoidant, they are people that are very defensive, especially they feel attacked in very easy circumstances, which I was in that same boat. I can tell you, a lot of that has to do with your own insecurities or that person's own insecurities and an inability to love yourself to a level that is needed. So if you're dealing with those things, if this describes you, you're trying to heal, most people I can tell you cannot admit when asked that they can't say that they love themselves. For a long time, that was me as well. I had a very difficult time saying that I love myself or even that I liked myself. And I think a lot of people are in that same boat. There's a lot of insecurities. There's a lot of things that we deal with. So self-love, being able to reach a point where you can say, I love myself is important in this process. And it's also very important before you can say you love anybody else. And I highly recommend before you bring children into this world that you go through this process of self-healing while you can now, before you have that added stress put back into your life, where now you need to care for somebody else. Because most of the time, what we do as human beings is we put our self-care in the backseat, especially when it comes to the people that we love. So our partner, our children. So take the time now, if you're going through this time where you're trying to work on your fertility, you want to have children in the near future, make sure that you and your partner are very healthy. Make sure that you have found self-love so that you can give love to somebody else. And that is going to open up so many more doors for you, especially from a perspective when it comes to being a parent. So take that for what it's worth. I hope that's some valuable insight. And as far as I think bringing this all together for everybody. Now, fertility isn't just about getting pregnant. It's about whether your body has what it needs to create, nourish, and sustain life. And this means supporting your gut and your microbiome, clearing toxins that block hormones and damage to eggs and sperm, eating and hydrating in a way that's going to replenish your mitochondria, using supplements and peptides and medications when necessary, and honoring the emotional, spiritual layers that often are left out of the conversation. And so this episode isn't about one right way. It's about giving you options, evidence, and hope so you can make an empowered decision for your health and your future. And I hope that in what I've offered you today is a valuable insight into fertility, what you can do from a nutritional, supplement, and lifestyle perspective to get your body in a point where you can conceive, and also to a point where you are mentally healthy, personally and relationally, to bring in obviously another life that now you're responsible for, to have a healthy body while you're doing it, and one that's also easily recovered after the process. So if this resonates with you, if you found value in this episode, share it with someone else on their own fertility journey, leave a review so the truth reaches other people, and follow the Vitalis Podcast for more episodes weekly. For personalized help and one-on-one support, reach out to me. You can view my 28-day detox protocol. There's a link in the bio, and I'm happy to give you all direct advice and walk you through this process. Health is not a one-size-fits-all approach. It is very person-dependent. Your story and where you come from matters. And so if you have concerns, if you have needs, or there are things that you are specifically working on, from detox to fertility to disease and lifestyle, please reach out to me. I would love to give you some advice and guide you on this journey. And ultimately, remember, your body is not the enemy. It's the vessel. And with the right support, healing is always possible. I want to thank you all for tuning in today. I have so much gratitude that I'm sending out to each and every one of you for tuning in and listening to this. I am so grateful to have everybody that is supporting this podcast, that is listening to it, and has found valuable insights into the information that I'm hoping to provide to each and every one of you. And I hope that in this episode and any of the other ones, you have found some nice nugget that you can take home and utilize in your own health, or that is specifically something that you're dealing with right now. So thank you all. It is always an honor. So much love for each and everybody out there, and talk to you all next week. Thank you so much. Thank you for tuning into the Vitalis Podcast. If you found value in today's episode, we'd be so grateful if you'd leave us a rating and a review. It truly helps us grow. Share this episode with friends and family who are also on a journey towards deeper health and truth. And stay up to date with weekly episodes. Be sure to subscribe on Apple Podcasts or Spotify, and follow us on Instagram at the Vitalis Podcast. Please remember, the content shared on this show is for educational and informational purposes only. It is not a substitute for personalized medical or mental health advice, nor does it establish a provider-patient relationship. Always consult with your physician or qualified healthcare professional before making changes to your health protocols.